Welcome to iasvideos.com. Only 20% of the full-length current affairs video is provided here. For remaining 80% and previous videos, visit our website. And also subscribe for general studies videos 2 through complete package. 4. India must step up funding in fight against tuberculosis. World Health Organization. This topic will be important under General Studies Paper 3. Promoting public health by combating killer diseases. Why recently in news? India is critical to the global fight to end an epidemic of tuberculosis by 2030 and must step up funding to control the disease, the World Health Organization said. As per the World Health Organization, WHO, India has recorded the largest number of tuberculosis cases in the world last year. Tuberculosis killed 1.5 million people in 2014, which ranks alongside HIV as a leading killer worldwide. As per the report, India, Indonesia and China had largest number of cases at 23%, 10% and 10% respectively of the global total in 2014. India and Nigeria accounted for about 1/3 of global TB deaths. How India should tackle the disease now that WHO said. Intensified efforts are needed to ensure that all cases are detected, notified to national surveillance systems, and treated according to international standards. It said that in order to reduce TB's overall burden, detection and treatment gaps need to be closed, funding shortfalls filled and new diagnostics, drugs and vaccines developed. Effective diagnosis and treatment saved 43 million lives between 2000 and 2015. What is tuberculosis and how it will be caused? Tuberculosis, TB, is a multi-system infectious disease caused by Mycobacterium tuberculosis, a rod-shaped bacterium. These bacteria are slow-growing, aerobic, and can grow within body cells, an intracellular parasitic bacterium. Its unique cell wall helps protect it from the body's defenses and gives mycobacteria the ability to retain. Mycobacteria that escape destruction by body defenses may be spread by blood or lymphatic pathways to most organs. If the immune defenses fail initially or at a later time, the bacteria continue to spread and disrupt organ functions. Are there different types of tuberculosis, TB? There are many types of tuberculosis, but the main two types are termed either active or latent TB. Active TB is when the disease is actively producing symptoms and can be transmitted to other people. Latent disease is when the person is infected with Mycobacterium tuberculosis bacteria, but the bacteria are not producing symptoms, usually due to the body's immune system suppressing the bacterial growth and spread. People with latent TB usually cannot transfer Mycobacterium tuberculosis bacteria to others unless the immune system fails. The failure causes reactivation. Bacterial growth is no longer suppressed. That results in active TB, so the person becomes contagious. What are tuberculosis symptoms and signs? Although there are a number of TB types, pulmonary TB is responsible for the majority, about 85%, of TB infections. Consequently, pulmonary TB symptoms and signs may occur with or even before other types of TB are diagnosed. The classical clinical symptoms and signs of pulmonary TB include fever, night sweats, cough, hemoptysis, coughing up blood-stained sputum, weight loss, fatigue, and chest pain. The elderly may just exhibit pneumonitis. What is the treatment for tuberculosis? The treatment for TB depends on the type of TB infection and drug sensitivity of the mycobacteria. For latent TB, 3 anti-TB drugs are used in 4 different recommended schedules. The drugs are isoniazid, INH, rifampin, RIF, rifadin, and rifapentine, RPT, Priftin, and are chosen by the treating doctor based on the patient's overall health and type of TB the patient was likely exposed to. In some patients, the lung destruction may be severe and the only treatment left may be surgical resection of the diseased lung tissue. 5. Justice T.S. Thakur is the next Chief Justice of India. This topic will be important under General Studies Paper 2. Appointment to various constitutional posts, powers, functions and responsibilities of various constitutional bodies. Why recently in news? President Pranab Mukherjee has appointed Justice T.S. Thakur as the Chief Justice of India, CJI, as per provisions of Article 124 of Constitution. T.S. Thakur will be 43rd Chief Justice of India and his appointment will come into effect from the 3rd of December 2015. He will have tenure till January 3, 2017, that is till he attains the age of 65. The Union Law Ministry had processed his file and sent it to the Prime Minister's office, PMO, for approval. From the PMO after its approval the file was forwarded to the President of India for approval. Qualifications of CJI. A person to be appointed as a judge of the Supreme Court should have the following qualifications. He should be a citizen of India. A. He should have been a judge of a high court, or high courts in succession, for 5 years. Or B. He should have been an advocate of a high court, or high courts in succession, for 10 years. Or C. He should be a distinguished jurist in the opinion of the President. It is clear that the Constitution has not prescribed a minimum age for appointment as a judge of the Supreme Court. Tenure of judges. The Constitution has not fixed the tenure of a judge of the Supreme Court. However, it makes the following 3 provisions in this regard. He holds office until he attains the age of 65 years. Any question regarding his age is to be determined by such authority and in such manner as provided by Parliament. He can resign his office by writing to the President. He can be removed from his office by the President on the recommendation of the Parliament. Removal of judges. A judge of the Supreme Court can be removed from his office by an order of the President. The President can issue the removal order only after an address by Parliament has been presented to him in the same session for such removal. The address must be supported by a special majority of each House of Parliament, that is a majority of the total membership of that House and a majority of not less than 2/3 of the members of that House present and voting. The grounds of removal are to proved misbehavior or incapacity.